Hello, family of God. Greetings from the Village of Hope in Ghana, West Africa. I pray and hope that you are all doing well. This year has been a terrible year with the COVID-19 pandemic. Life has been tough all over the world. But I pray that the protection and the blessings of God are with you and that God is keeping you safe and keeping you healthy. I bring you greetings from all the children and the staff of the Village of Hope here in Ghana. And I want to take this opportunity to give you a report through the power of technology. God has blessed us with wonderful technology so that even though we may be separated by thousands of miles, we are still able to communicate. And it's a privilege and an honor that I have been given to give you a report on the work of the Village of Hope. Once again, thank you for this privilege and honor to come to you and to give you a report on the work that we do here in Ghana. As you know, the Village of Hope has a children's home as well as a street teenagers ministry, a hospital, and some schools where we provide Christian education to children. And this report will cover all these ministries. The ministry to the children who have been abandoned, who have become destitute, who need help, as well as the ministry to those teenagers who live on the streets, and the ministry through Christian education and through the provision of good health care to the people who so desperately are in need of good health care. Let me begin with our educational institutions. Village of Hope runs 3 schools: Hope Christian Academy, which is a pre-K through 9th grade school, and Church of Christ School, which is also a pre-K through 9th grade, which is located in the eastern region of Ghana, and then Hope College, which is a high school for students from 10th grade through 12th grade. Because of the COVID-19 pandemic, schools have been closed by the government since March of this year. And so over the last 8 months, there has hardly been any schooling going on. All students have returned home and our schools and classrooms have been closed. This has brought extraordinary hardships on the staff of the schools, because without the students coming to school, no tuition and no other fees are paid. And without fees being paid, it is virtually impossible to pay our teachers and the other staff of the school their monthly salaries. So it has been extremely difficult, and we have been struggling to be able to help our teachers, but we just don't have the funds to be able to pay them. What we have done over the past months have been to provide stipends for them, just to help them put food on the table, just to help them feed their families. And so over the last several months, we have provided each month a little stipend, which is far less than their normal salaries, so that they can feed their families. There are many schools, private schools, that have completely closed down because they don't have the means to sustain their teachers and their staff. So it has been really tough, and it's been very sad to see committed and dedicated teachers who have given their lives to Christian education go through such suffering and such difficulties because there are no students in schools and we just don't have the money to pay them. But God has sustained us up to this time, and we pray that God will continue to sustain us. Currently, the government has allowed only the 11th graders in high school to return to school for 10 weeks. And the government has also permitted the 8th graders in elementary school to return to school. So for the elementary school education from pre-K through ninth grade, and high school education from 10th grade through 12th grade. We're talking about 14 years gap and 14 different grades from creche or pre-K onwards. And there are only 2 grades in school. Only the 11th graders and the 8th graders are in school. And this has been made possible because they can practice social distancing with all the other students not in school. But it also means that the monies they pay for school fees is not adequate to take care of the teachers, and they are in school for only 10 weeks. They came only 2 weeks ago, and they will be in school till just about the time for us to go for Christmas, and then they would break. Our hope and prayer is that in January of 2021, schools will reopen again, and the students, all students from pre-KG through the 12th grade will return to school. When that is done, normalcy will be restored. But we want to plead with you to remember our teachers and to remember the school staff in your prayers. It has been very, very, very difficult living without your monthly salary and taking care of your family. It has been extremely difficult. So please remember them in your prayers. Staff of Hope Christian Academy, the staff of the Church of Christ School, and the staff of Hope College. Please remember them in your prayers. That God will sustain them, and that hopefully in January the government would allow schools to reopen so life can return to normalcy. Concerning the hospital, it has been a lifeline and a life-saving institution for the villages around. The hospital serves 3 counties in the central state of Ghana. Population ranges well over 80,000 and up to maybe 100,000 people in these 3 counties, and this hospital serves those people. And sometimes we have people even coming from outside these counties coming to receive healthcare at the hospital because they do such a fantastic job in providing quality health care to patients. But unfortunately, once again, because of COVID-19, number one, people have been scared to even go to hospitals. They are afraid that if they go to hospital, they will contract the COVID-19. So many people don't even show up, and that has reduced the patient attendance significantly. Furthermore, because of COVID-19, people have been advised by the state that if you're not really sick, then you don't have to, go to the hospital, just so we don't have hospitals crowded with people who may not need urgent or emergency care. It means that hospital attendance, which used to run between 80 to 100 patients a day, 80 to 100 patients a day, has reduced to maybe 20 to 30, between 20 and 30 patients a day. And that's a significant drop. It's like an 80% drop in attendance. And with that, it means that the hospital is not receiving enough patients and caring for enough patients to be able to run, to be able to operate as it normally does. The unfortunate thing is that many people stay at home for so long that by the time they really think they need to go to the hospital, it's almost too late for them to receive any quality care. Because right now what has happened is that overall attendance has reduced, but emergency cases have gone up. So people stay at home when they are sick. Ordinarily, they would have come to the hospital to get checked and then to receive medication or treatment. But now, when they are sick and it's not very severe, they just stay at home. And they stay at home, and then their condition gets worse. Now, when they are in trouble, when they can't do anything about it, they are rushed to the hospital. And it's almost like every time we are receiving emergency cases because they've waited at home for so long. And when they come to the hospital, sometimes it's just too late for the medical staff to do anything to help them. And it's very pathetic, that people are dying when they don't need to die. They are dying from easily treatable illnesses and sicknesses, but they just stay at home for too long trying to avoid going to the hospital, and by the time they come, it's just too late. So there are so many heartbreaking stories about people losing their lives just because they made the wrong decision and they stayed at home for too long. But remember our hospital staff. They're doing very well to help the sick at the risk, at the peril of their own lives, because sometimes even the protection against COVID-19, the personal protective equipment that they need, they don't have. And so they still have to treat patients at the risk of contracting COVID-19 or contracting any, infectious diseases. They sacrifice to be able to provide quality health care to the sick. And do remember them in your prayers. It's been hectic. They don't have any time to rest. Fatigue sets in. But in these very strange and extraordinary times, they don't have the luxury even to take a break. They are tired, but they are still working so they can provide quality health care to those who need it. So remember our hospital staff, the doctors, the nurses, those who work in the laboratories, those at the pharmacy, the eye clinic, the dental clinic, the maternity or maternal health clinic, and those in the mental health department, and all the hospital staff. They need your prayers, and so please remember them in your prayers. And I want to now give a report about the street ministry. The street ministry helps teenage boys and girls who live on the street by taking them off the street to Hope Training Institute, which is a trade school, a vocational school, to give them some skills so that after they've acquired the skills, they can start their own businesses or they can gain employment elsewhere, and they don't have to return to the street. The whole goal is to get them off the street, to give them a skill, and to teach them about the love of God and about Jesus Christ. And we thank God that many of these teenage boys and girls have become Christians, and because they have seen the love of God practiced, in real. And so it's a blessing. It's such a wonderful ministry, reaching out to these boys and girls who live on the streets, who have been neglected by society, neglected by their families, and neglected by loved ones, and they just have no hope. And this ministry to these street boys and girls gives them hope for a better future, physically and spiritually. This ministry gives them that hope. Currently, we are training about 40 boys and girls who have been picked off the street to receive skills training. They learn to sew bags, to sew shoes, and do other kinds of leather works. They learn to weave. They learn to sew clothing. Some of them are learning auto mechanics, how to fix vehicles. Some learn hairdressing and other skills, just to help them acquire skills that are employable or that they can start their own businesses, And so we have about 40 boys and girls who have been moved off the street that we are currently training. Well, with the outbreak of COVID-19, we have had to keep them on the campus of Hope Training Institute, because they are safe on campus. If they go out there, they are exposed to the COVID-19 virus, the coronavirus, and they're also exposed to all kinds of moral and physical dangers. And so we've kept them on campus for almost 8 months, and it's tough. These are teenagers who have lived on the streets, who know freedom. Freedom to roam about the streets, freedom to do whatever they like, and now they've been brought into an institution, and for 8 months they've been kept at one place. For 8 months they have not been able to go out, and it's very, very tough on kids who are used to roaming about and moving about freely, but for their own safety, we have kept them on campus. And so it's been tough on these teenagers, just staying at one place for 8 continuous months without going out. During those 8 months, it's been good for them that in that they have been protected from contracting the coronavirus. They have been protected from all the evils out there on the streets. And they have also been given skills. Whilst they stay on campus, training goes on, teaching goes on. And so they have been acquiring skills. And they have even learned how to sew face masks, to protect people against the coronavirus. And they have learned to manufacture other personal protection equipment, the PPEs, to fight this COVID-19 pandemic. So they have stayed on campus and acquired skills and been protected. But it's been tough on them because they've just stayed at one place for so long. Now imagine how tough it has been on the teachers, the instructors, those who train them, the trainers, because they are boxed down on our campus with these teenagers. So the teenagers don't go anywhere, the instructors don't go anywhere, and they are all there together and they are training the kids. It's been really tough, psychologically and emotionally and physically very tiring for our staff. But they've been, up and doing. They have shown love to the children, the teenagers. They have really given off their best, opened their hearts to really helping these teenage boys and girls. And so they are doing well. The teachers, the instructors, the trainers, as well as the teenagers that we've brought off the street. But it's been difficult. COVID-19 has really been tough on so many people, including the teenage boys and girls and their instructors. But God's been good, and no child and no instructor or trainer has contracted a coronavirus. So all of them have been safe, and we thank God for that. I want to talk about now the children's home, Hope Children's Village, the orphanage that cares for orphaned, abandoned, destitute, and needy children, and also cares for children who have been rescued from child trafficking and children who have been rescued from child slavery, and have been brought to the children's home. We are caring for about 200 children, from very little ones all the way to those attending college. So it's a broad range of children that we are caring for. And because of the COVID-19 and because schools have been closed down in Ghana, all the college students and all those students in high school who used to live in the college dormitories or halls of residence, and the high school kids who also are boarding students who live in dormitories of the high school. Everybody was given an opportunity to come back home. Once the schools closed down, they had to come back home, which is to the Village of Hope. And once they came, we had to close off our campus to the public. It was a measure taken to protect the children and the staff from contracting the COVID-19 disease, the virus, the coronavirus. And so they have also been at home for about 8 months, and so now we have houses that are full of kids because all those who were in school have now come back home, and they are receiving care. Of course, they get the food to eat and the water they need and the shelter and the clothing and the love that they need. So it's been ongoing for the last 8 months that these children have been home in the cottages of the children's home, and they are being taken care of. Once again, we are grateful to God that no one has contracted the coronavirus. No house parents and no caregiver and no child of Village of Hope has contracted the coronavirus. So we give thanks and praise to God for that. We want to invite you to join us in thanking God for protecting all of us here at the Village of Hope. But it's been very challenging. It's been very difficult. Number one, we have all the kids at home. and they are all eating. And so when kids are at home and they have nothing to do, they just eat and eat and eat. So that's quite a tough challenge on our supplies, because they are home eating and using water and all the other things, supplies at home, and depleting the resources available for their care. Furthermore, because of COVID-19, people have just stopped going out. And so people who would usually visit the Village of Hope and make donations no longer show up. And they no longer visit, and they no longer make donations. And so donations have gone down drastically. Donations have gone down very significantly. It's been really challenging. That at a time when all the kids are at home, they are using more food, they are using more detergents, they are using more of everything, more electricity, more water, more of everything. At that same time, donations have been dwindling and coming down, and it's been very difficult. We thank God that we've been able to sustain them, we've been able to provide for them, but it has not been easy. It's been really difficult for us because donations have really diminished, and the visits to the children have equally diminished. So it's been tough, and God continues to sustain us, but we need help. We need help to be able to help these children. We run a charity to help the helpless, to give hope to the hopeless, and we solely depend on donations. And so I want to make a special appeal. If God places it on your heart and you can help us, please help us. Please help us to be able to help these children. Let me tell you another big need we have. Recently, we started receiving abandoned babies. We have started a new babies home, because there are many babies who are just abandoned by their mothers. And when times are tougher, you would think that a mother will never abandon the child, having kept this child for 9 months before delivery. But unfortunately, that's not the case. And some mothers would just abandon their babies, and these babies die because they have no one to take care of them. They have nowhere to go. And we have responded to the call of God that we will be the hands of Jesus to receive these kids. We would show the love of Jesus to these children, these babies. And so now Village of Hope is operating, in addition to the children's home, a baby's home. And currently we have 2 babies. One was about 1 week old when she was abandoned in the bush and was found by somebody, and the Department of Child Services brought that baby to the Village of Hope. And just about last week, a 1-year-old boy was just abandoned, and the police did all they could. They couldn't trace the family, they couldn't trace the parents, they couldn't trace any relation of this 1-year-old boy. And he has also been brought by the Ghana Department of Social Services and Child Services to the Village of Hope. And so we have these babies. This baby's home is actually for children up to the age of 2 years old. And that is a new thing we're doing. We haven't done that in the past. And that is something that we need help with. Help to provide the milk and the formula, the baby's formula, and the baby's clothing, and all the things that babies will need, all the things that babies will need to survive. Because these are tough times, but we don't neglect babies and children that need help just because times are tough. Sometimes we have to step out in faith, and that's exactly what we have done. Step out in faith to help these children, trusting that the Lord will provide. And we are trusting that through you, the children of God, the people of God, that God will provide for the care and for the upkeep of these children. One other need we have is that just recently we have been called upon to save some children who are in the Church of Christ Children's Home. The Church of Christ Children's Home was established some 14 years ago to take care of children that need help, orphan and destitute children. And over the years, this home has faced some difficulties and some challenges. And the elders of the church have called upon the Village of Hope to help by receiving and helping these children in the Church of Christ Children's Home, because it was really going down, and we had to step in to save it from collapse and to more importantly help those children there. There are about 28 children that we have taken responsibility for, and we need help and we need support to be able to help these children. Our most pressing need right now is, when we took over, we realized there's a great need to renovate the facilities of the Church of Christ Children's Home. There's a great need to renovate the facilities. And right now, we need $8,000 to renovate the homes where the children live, to provide them with a decent environment to live. And so I am pleading with you, if you can help us, please help us. We need $8,000. It's urgent, it's necessary, and it's going to help us renovate the facilities of the Church of Christ Children's Home, which is located in the town called Bongo in the Upper East region of Ghana. The Church of Christ Children's Home in Bongo in the Upper East region of Ghana. We need $8,000 to be able to renovate the facilities, equip the facility, so that these 28 children can live in a very healthy and good environment where they can be developed physically, emotionally, psychologically, and more importantly, spiritually. If we provide all the food and all the water and all the clothing and all the education and all the health care, and we don't care for their souls, if we don't teach them about Jesus, if we don't bring them to God, we have done nothing. So we, in addition to doing everything else, want to provide for their spiritual care. And we need your help to be able to do this. Let me read to you from the Gospel according to St. Mark, chapter 10, verse 13 to 16. People were bringing little children to Jesus for him to place his hands on them. But the disciples rebuked them. When Jesus saw this, he was indignant. He said to them, "Let the little children come to me, and do not hinder them, for the kingdom of God belongs to such as these. Truly, I tell you, anyone who will not receive the kingdom of God like a little child will never enter it." And he took the children in his arms, placed his hands on them, and blessed them. Is that not wonderful? Jesus took the children in his arms. Jesus placed his hands on them, and Jesus blessed them. And that is what we are inviting you to do. Be the hands of Jesus that blesses children. Be the arms of Jesus that takes in the children. Be the laps of Jesus where the children will sit. Be Jesus Christ and provide a safe haven. Provide hope. Give these children hope, not only for this world, but for eternity. Be a blessing to the children. We want to invite you to be a blessing to the children that need your help. Be Jesus to them. And we thank you once again for this privilege to come to you and to present this report to you and to present these needs to you. Thank you for allowing us to do this. And we pray that you would continue to partner with the Village of Hope to be Jesus and to show the love and the compassion of Jesus and of God to these children. Let us welcome the children. Let us receive them into our arms. Let us bless them. And if there's any way you can bless these children, please be a blessing to them. Thank you very much, and God bless you. We send you once again greetings from Ghana. Thank you.